Hello, good morning. Welcome back. Today we'll be discussing about breastfeeding, the importance of breastfeeding. Due to I say because it's our time, our generation, most mothers don't depend on breast milk. That is breastfeeding to wean their child or children anymore. They depend on milk, on formula, on all this food to uh, to wean children. Instead of going back to the normal way of breastfeeding, they will give you excuses that they want to maintain their shape. So today we'll be listening to the importance of breastfeeding. What this breastfeeding, it gives children, how it helps in a child's development. So today we'll be listening to a nurse who will give us a lecture on the importance of breastfeeding, why it is necessary to breastfeed a child.
Good morning, once again. Um, Breastfeeding is said is the best feeding formula for babies. Breast milk is the best milk for our babies. The importance of breastfeeding are numerous, but I just have to mention a few. One, it is cheap. It is saved in a very concrete save. You don't find it to destroy it. The mixture is just very much appropriate. You don't make mistakes by measuring milk and measuring water. It is a bond that binds mother and child. We even believe, because it's what people believe that is the subconscious gives us back, that children breastfed are more intelligent than children on milk and water, artificial milk and water. Their IQ, the children breastfed, have their IQ is better than others. These children who are breastfed have more wisdom. It's not that those that are not breastfed don't get one out of 10 gets those advantages, but we're talking about breastfeeding. Nothing to compare breastfeeding. Nothing to compare to breast milk. To the extent that even the HIV patients, when we started, HIV came in newly, we always tell the women not to breastfeed their babies. But with time, scientists, researchers continue to improve on that at present, even HIV patients breastfeed their babies. But they are taught how and when and duration of the breastfeed, because breastfeeding remains the best feeding for infants. Thank you.
Okay, is there any duration at all that a mother is expected to breastfeed a child?
Yes.
And are there anything you have to say on exclusive breastfeeding or
Yes. There's what we call exclusive breastfeeding. In exclusive breastfeeding, mothers are expected to breastfeed a child only with milk for 6 months. Only but with milk. But there's one thing I used to tell mothers, because it's due to death, infection, illnesses incurred through bottle feeding, spoon feeding, and all these things that we came out at last to give only breastfeeding. Yet, some women still feel it. But because the primary reason is to avoid introducing death to babies. Yet, some women can still breastfeed their babies without even washing their breast. You find out that the same death is being introduced to the babies, which brings about illnesses, diarrhea, vomiting. Therefore, when we talk about breastfeeding, we talk about hygiene, hygienically exclusive breastfeeding. It's very, very encouraging. These babies are outstandingly healthy. They rarely fall sick because of no infection through the breast, except if the mother is exclusively ill. Then it is understandable by even the physician.
Okay, coming to this, my question goes: is there any duration a mother is expected to breastfeed a child?
Yes, I'm coming to that. So, in exclusive breastfeeding, the best time is from 0 to 6 months. Then from 5 months, you start to introduce water and other diet to the baby so that by 6 months, the baby will be able to be weaned out of exclusive breastfeeding. When we say exclusive, we mean only breastfeeding. But by 6 months, you introduce other things, water, food, other diets. So the breastfeeding can now be extended in addition with other diets to 9 months. Mothers can even breastfeed more than 9 months, but what we are saying here is that after 9 months, no, no, the breast milk does not contain any antibody again, does not contain any food value again that exposes the child or the babies to infection, to illnesses if they are not introduced into the family diet. Thank you.
Okay, is there any advice you would like to give to breastfeeding mothers now, those that are still within their child?
Breastfeeding mothers, I advise you that once you give exclusive breastfeeding for 6 months, once you introduce the family diet, you start to wean the babies, because weaning of babies is something that is done gradually. Some women don't even know it. Some couples don't even know it. That brings about a child who is being weaned falls sick. When you wean the child abruptly, quickly, not introducing the child to other diets before then, not stopping the child by timing. Because any child you want to wean in the next 1 month, you start today to wean the child by maybe you give the baby, let me use the example, you give the child a baby breastfeeding 6 times a day and 4 times at night, which is a total of 10. By the time you know you want to wean this child in the next 1 month, you start reducing the number of times you give this baby breast milk. You start to give the baby food in between the breastfeeding. You start to reduce the breastfeeding at night in particular. You start to introduce the baby to other things in the night, water or pap or biscuit, something that will make the child to start forgetting about breast milk. This will help you on the day you decide that you will not breastfeed this child from this day again. The child will not even remember that you have been feeding him or her, because if you don't give the baby the breast milk, it will not give you trouble. You yourself will not have the problem of maybe breast pain and engorgement of this, because your breast, when you start reducing the number of times you give in a day to the quantity you give, the breast starts doing what? Drying up gradually and to the end. Thank you.
Okay, we've had it. the importance of breastfeeding.